Welcome to Volunteer State Primary Care Clinic. My name is Dee Dee Stover. I'll be your guide today. In this video segment, we will review the National Asthma Education and Prevention Program guidelines for the diagnosis and management of asthma. In these next few video series, we will first review the NAEPP's purpose, goals, and objectives. Secondly, we will look at their components that involve effective patient care. Thirdly, we'll look at exacerbation management. And finally, we'll look at the clinical activities for the diagnosis and management of asthma. Pull out some pen and paper. You're going to want to take notes. We'll begin our review in just a moment. The National Asthma Education and Prevention Program, or NAEPP, was initiated in March 1989 to address the growing problem of asthma in the United States. To accomplish these broad program goals, the NAEPP works with intermediaries, including major medical associations, voluntary health organizations, and community programs to educate patients, health professionals, and the public. The ultimate goal of the NAEPP is to enhance the quality of life for patients with asthma and decrease asthma-related morbidity and mortality. The goals of the NAEPP are to raise awareness of patients, health professionals, and the public that asthma is a serious chronic disease. Their goal is also to ensure the recognition of the symptoms of asthma by patients, family, and the public, and the appropriate diagnosis by health professionals. Their last goal is to ensure effective control of asthma by encouraging a partnership among patients, physicians, and other health professionals through motto treatments and education programs. The NAEPP has several objectives specifically designated for patients and the public, and then for health professionals. Take a moment and pause over each slide to review each objective in detail. The NAEPP guidelines recommend key clinical activities for establishing an asthma diagnosis. They include using the patient's medical history and physical examination to determine that symptoms of recurrent episodes of airflow obstruction are present. This also includes using spirometry in all patients who are greater than 5 years of age to determine that airway obstruction is at least partially reversible. If either of these methods are inconclusive, alternative causes for airway obstruction may have to be considered. If we are managing our patients' long-term asthma care, there is one particular goal that we are hoping to achieve. That's asthma control. This is demonstrated by two very important ways. The first is the reduction of impairment. The second, the reduction of risk. Reducing impairment is done by preventing chronic symptoms that require infrequent use of short-acting beta-2 agonists, maintaining near normal lung function and normal activity levels. The guideline later goes on to include the goal of meeting the patient's and family's expectations and satisfaction with the asthma care. To reduce the risk, we will prevent exacerbations, minimizing the need for emergency care or hospitalization, preventing the loss of lung function, or for children preventing their reduced lung growth, and having a minimal or no adverse effect of therapy. The guideline also includes the goal of providing optimal pharmacotherapy with minimal to no adverse effects of that therapy.